Now, your health, your safety. This is ABC7 News.
Hi there, I'm Kristen Z. Welcome to our daily special called Getting Answers. We're asking experts your question every day at 3 o'clock to get answers for you in real time. Today, we'll get into how Taiwan has managed to keep its COVID-19 cases and deaths extremely low and how that might apply to us as we start to reopen. So post your questions on our Facebook live stream, YouTube Live, or check out our Instagram stories to submit a question. But first, effective immediately, as you know, Napa County is allowing dine-in customers for restaurants now. It surprised a lot of people, including at least one restaurant owner we found. So let's take you up to Napa for a tour at what restaurants may look like as more of them start to open here in the Bay Area. Joining me now with his mask on is Mauro Pando, chef and owner of Grace's Table in Napa. Hi, Mauro.
Hey, hi.
Hey, good to see you. So I understand Grace's Table is a popular spot, right, in downtown Napa. You guys offer dine-in service today. So tell me, when and how did you find out you could actually do dine-in today?
Well, it came out all of a sudden. We've been doing to-go service now for about a week, and we showed up today with some news channels, NBC News, was outside, and I had some other people, fire chiefs and other people walking around surveying downtown, and it became aware that Gavin Newsom, with his time up here at Mustard's Grill on Monday, had the Napa County go into stage 2 as of last night. Mm-hmm. I didn't see it last night. I found out as I was walking into the restaurant this morning. Mm-hmm. I sent out a little media blast at 8:30 saying to-go brunch is ready. And then it turned out 10 minutes later, I said, well, actually, in-house dining is ready too.
So what time did you seat your first diner?
Well, it was about 10:30. About 10:30, the person ordered to go, and they realized they could actually sit down. Okay. And we put a nice table outside for them.
Ah, okay. So that's what I would like you to show me. If you can walk me around and show me how you're setting up the tables, right, for people who want to sit inside or outside to ensure the social distancing.
Sure, absolutely. So we have a ruler to make sure we're 6 feet away from chairs and tables. Uh-huh. I had 17 tables in this dining room. Now I have 7, all spread out. Our bar seats, if there's 2 people together, they can sit, but we'd have to move them around so that the bar would end up being just a little seat. Since this isn't a tasting room or a bar in particular, it's just a one-room dining spot, we could have maybe 4 people or 3 people at the bar right now. And we could have 1 person over here if we needed to, and 7 tables behind me. And then we have our outside dining, which is, we're not set up right now. We have this all spread out. We were just closed down. We could use the breadth of the breadth of the restaurant's wall all the way down to the back of the restaurant wall. Mm-hmm. The Napa Chamber or the Napa County and ABC has made different rules for the restaurant to be able to change their encroachment outside dining permits to be able to use a larger area so that we're able to create that 6-foot spacing. I'm sorry. I just as we were speaking, we had this set up, and my guys are very efficient. We just finished up service.
No, I get it. No, that's great. That's great. So you can move the more tables. That's totally fine, Mauro. I appreciate that. Hey, you also redesigned your menus, right? Because I know now you want it so that it's not like people are touching the same menus over and over again.
Right. We have just a paper menu, a simple paper menu. I was wondering why I bought 5,000 sheets the other week, and they showed up. But now I have good use for all my just regular paper. Goes out, and then we're done with it. Our no shareable items on the table, no salt and pepper shakers, nothing, no condiments are going to be given. Paper napkins, so the server isn't touching a napkin and then going to another table. So we're making sure that, it's disposable as we can, but yet giving a very nice service, hospitality experience.
How were you able to turn it around so quickly and be able to do the dine-in? I mean, you had all the food ready to go, I guess, because you were doing takeout. But did you have your plans submitted to the county beforehand, or at least ready to submit?
I was hoping to get my loans late because the PPP loan did really help me figure out how I was going to budget to open. It's like creating a brand new opening. I did manage to delay my funding because as soon as it lands, it starts counting the clock starts counting. So I managed to get mine last Monday. I was hoping to do about a week worth of to-go service while I was emptying the dining room, getting all the spacing correct, getting all the protocols for my staff correct, and making sure that everybody was in place and everybody was getting paid, got all the food all coming in. I made a nice menu that was able to be large enough to open with, and also small enough to be able to operate efficiently for a nice to-go service.
Yeah.
We did very good service this last Sunday. We did good service to go this last Monday and Tuesday yesterday. And when they said we can open, it was seamless for us because I was ready to open.
Gotcha. Now, Robert wants to know, what if somebody wants salt and pepper? Are they in little paper baggies since you took them off the table, like you said?
Well, you know, today, since I wasn't ready for my little individual packets, it just went out in a ramekin that we just poured into the salt and pepper and then thrown away once they were done with it.
Gotcha. Hey, I know you're just starting back up. What was the reception today from people? Were a lot of people asking to dine in, or are people kind of still waiting to see how it goes?
There's a lot of people still waiting. It's a lot. And we just had more than a handful of in-house diners. Yet the buzz and the joy of having the restaurant operating like this, it just gave everybody just a nice, warm, happy feeling. My guests came in, and one of them came in from, they said 30 minutes away. They said as soon as they saw the first open restaurant for in-house dining with the protocols in place, they were going to go. And we were the first one that they ended up coming to. So we're real happy. Everybody seemed, I waved a guy to hello on the sidewalk, and he was in the car. He pulled over. He said, "Wait a minute, you are open. I'm coming in." So it's just a happy, kind of joyful opening. Yet we're all knowing that there's a responsibility, and it's not going to happen overnight. The 25% dining is actually what's going to happen, even if we weren't made to be that. It's not going to be like it was, even if we wanted it to. It's not going to return like that. So I'm happy that we're going to make a go of it the way it is.
Yep.
And I know from here, it's a good starting place for everything that's happened to all of us. So it's a good place to start. We're taking it slow, and we're going to take it safely.
Now, I know today you didn't do dinner service, but that's in the works, right? Can you talk about that and whether people need to make reservations?
Yes, we'll be opening up a reservation book today for the weekend, Friday, Saturday, Sunday, and then all the way through every day after that. It's going to take me a day to get my risottos and my ratatouille, my roasted chicken, my cassoulet, and my sausages. The dinner menu is going to be prepped for one day, and then we'll be open for all-day service from 8:30 to 9. Monday through Sunday every day. So one of the key factors of Grace's Table is that we're able to do 25% service for 13 hours a day. We open at 8:30 and we don't close until we're done. So we're able to have a long service.
Right.
And we'll just go through the whole day. And in the end, where we didn't have those 3 o'clock diners, we will. Where people who didn't want to have a dinner or a lunch rush, they'll come before or after, and we'll be able to.
All right, Mauro, I just wanted to share one comment that we're getting in on Facebook for you. Francis Anamosa says, "Thank you. You are one of our favorite places. The steak and fries are the best." So I'm salivating just reading that comment.
Well, I have some community outreach here across the street. The Bubbles Napa is just opening, and we were planning on doing a barbecue in Bubbles, and we still are this weekend for a pickup for Prosecco and your barbecue favorites this weekend.
Mm-hmm.
So we're still playing around for that in-home dining experience as well as in-house dining experience.
All right. Well, Mauro Pando, it was a pleasure talking with you. I know this is a big day for you and more exciting days ahead. So take it slow, take it safe. Good luck to you. Appreciate it.
You as well. Thank you very much.
Thank you. All right, that was really interesting. As you know, they are just opening for dine-in service again. But you know where they've been doing that? They've never stopped, is in Taiwan, in Asia. And actually, they've been able to keep the numbers down as well, while being able to kind of keep life sort of normal. So next, we're going to talk to a local expert about what Taiwan has done and whether that model will work for us as we start to reopen. That story coming up. All right, Mauro, don't go yet. Don't go yet. I want to say thank you. Appreciate it. Good luck to you. See you later. Have to come up one of these days. All right. Eric, we're good to go. Yes. All right. Hey, Facebook friends. Thank you so much for joining me today. I really especially appreciate these commercial breaks where we get to talk directly. I want to see more comments come in right now, especially if you guys have any questions coming up for our doctor and then a policymaker with regard to Taiwan. It's a small island, as you know, off the coast of China, which has done extremely well in terms of managing COVID. So we're going to explore how they've done it and specifically how they've done restaurants, schools, shopping. It's a densely populated island. And so how have people been able to go about living their lives, really, and still keeping those numbers down? That's what we're going to explore. So if you have a question, post it on Facebook right now. And I'm going to say hello to Dr. Jason Wong. Hi, Jason.
Hi.
Good to see you
Kristen.
again.
How are you? Good to see you. How are you?
I'm good. I heard most of your presentation for the Hoover Institution. I really enjoyed it. That was great.
Oh, thank you very much.
Oh, yes. Okay, a request to beautify this shot. If you can tip your laptop camera down just a little bit, angled downward a little bit. How's that? Perfect? It's perfect. Thank you.
Great. Thank you.
All right, Eric, how much time do we have for Dr. Wong? 5.5 minutes-ish. All right, cool.
30 seconds back.
Okay. All right, 20 seconds, Jason. See you on TV.
Okay.
15 seconds. You're coming back live in 10, 9, 8, 7, 6, 5, 4, 3, 2.
Welcome back. You've probably heard about the island of Taiwan. Despite only being 80 miles off the coast of China with lots of business and personal ties, they've managed to keep their COVID-19 cases really low. 7 deaths, 440 total cases. So what is the Taiwan model, and could it help us as we begin to reopen California? Joining us now to talk about lessons we can take from Taiwan is Dr. Jason Wong. Dr. Wong is the director of the Center for Policy Outcomes and Prevention at Stanford. Thanks for joining us.
Thank you very much for having me.
Dr. Wong, in the past, we've talked about the institutional things that helped Taiwan get a handle on COVID-19 early. The system developed really out of necessity after the SARS outbreak. So clearly, the numbers suggest the model is working. Is Taiwan society right now operating pretty much normally?
Yes, the schools are open, all the shops are open, and it's baseball season, so people are going to the stadiums to enjoy baseball.
Okay, so everybody does wear a mask there, right? I mean, how important has that piece been in terms of preventing the transmission of this kind of virus?
Yes, everyone is wearing a mask, and the masks are provided by the government. And so with the National Health Insurance card, you could pick up your mask and you pay 20 cents per mask.
And when you say national health insurance, that means health insurance for everybody. Everybody's covered in the nation?
Correct. correct.
Okay. So as we start to reopen then, share with us how Taiwan has been doing things, like the things that we're about to start doing. We just talked to a restaurant that's starting dine-in service. So talk about dine-in, okay? What are restaurants doing to keep their employees and customers safe?
Sure. So all the employees need to have their temperature checked. And then if they have any symptoms, they can't come to work. So we're talking about if they have, even coughing, sore throat, sneezing, fever, then they should stay home. And so every day employees show up to work, they will have their temperature taken. The tables, half the tables are removed. And so it keeps social distancing between one table to another. Some restaurants also use dividers. And so these are sort of transparent dividers so you could still see each other, but it prevents sort of, spread of, when you're talking, spread of saliva or across the room or across the table.
Now, I've seen customers having their temperatures taken as they enter a restaurant too, right?
Yes, and so some restaurants also require customers to have their temperature taken.
And does that happen at shopping malls too, at retail stores? Same thing, temperature checks?
So in public spaces, usually they require temperature to be taken. I'm not so sure about every single shop, but because there are no cases currently, so they didn't have a case for these 12 days, and there's not been a domestic case for the last 32 days, and so people are sort of even though they're wearing masks, but whether or not all the stringent efforts in the beginning, some of them are relaxed a little bit.
Can you talk about schools? Because that's something a lot of us here care a lot about, right? In a few weeks, you might have some schools or camps resuming, although realistically, we're looking at the fall for most people. What are schools in Taiwan doing as kids enter the campus to keep kids safe?
Right. So even before the schools were open, there were a lot of public health messages on TV to teach children how to wash their hands, singing 2 birthday songs and use the soap. So they did that for a few weeks before they reopened the schools after the Lunar New Year's. And then students are also provided with masks. So they get 10 masks every 2 weeks, so 1 for each school day. And then when they go to school, they have to wear their masks, and then they have to wipe down their table, and then there are dividers between the seats. And then they are taught to wash hands frequently during school.
I've even seen like sanitizers where kids stick their hands or their backpacks and then, it's sprayed on you. And my cousin shared with me a picture of his child. I mean, he's in kindergarten and every kid in kindergarten has their mask on. And it's amazing the degree of self-control that 5-year-olds have.
Yeah, I think, in the beginning, I'm sure, people, it takes some time to get used to, particularly for a 5-year-old, but then people do get used to it. And so it's something that if you see other people doing it, then it becomes norm.
I guess so. And the pull of cultural norms is really strong. You see everybody else doing it, and then it becomes what you do. I want to talk about air travel a little bit. We're getting a comment from Don Lee saying, Taiwan checked my temperature at the airport when I came from China. They quarantined sick people with fevers. I want to ask you, as we start to see traveling, air travel pick up here in the U.S., and at the same time we're seeing pictures of packed planes with middle seats occupied. What should we be thinking about? What do we need to do here to keep air travel safe?
Certainly, having their temperature check is one strategy, but, some of the patients with COVID-19 do not have fever. So that's not the only thing. I think you should also ask people for if they have symptoms of cough or runny nose or shortness of breath. And so maybe one way to do this is to have people submit an online declaration form of their symptoms. And then you could take their temperature, and then you want to make sure that, you have their travel history if they're coming from abroad, or even domestically if they're coming from sort of endemic regions of the country. You pay more attention that way. And lastly, I think because people are going to be in the confined space for a few hours in the airplane, if somebody in that airplane is later to be found infected, you want to be able to track the other passengers on the same plane to do contact tracing. So you might want to have their phone number. And I think airlines routinely already have people's passengers' phone number or email.
Yes.
So that might be something that you might want to do. We're currently also running an experiment out of Stanford. It's going to be going from San Francisco to Taipei, and we're going to actually do tests of the passengers, make sure everybody on the flight is negative before we let them board. So that's also one strategy, pre-boarding test.
All right.
And we're trying to, so that we're trying to do that experiment at the moment.
Well, please keep us posted on that test and see how it goes. But Dr. Wong, Director of the Center for Policy Outcomes and Prevention at Stanford, thank you so much for sharing your insight with us today.
Thank you very much for having me.
Take good care.
Bye.
All right, now that we know how Taiwan has succeeded in keeping deaths and cases low, can that be replicated here in the U.S.? We'll continue the conversation with another expert right after the break. But right now, join us on our live streams for some extra content.
We are in commercial break.
All right. Jason, thank you so much. Good talking with you as always.
Bye-bye.
See you soon.
Thank you.
Bye.
Bye.
All right. Hey, I wish I could get to each and every one of your comments here. There's so many good ones, and I really appreciate that. Unfortunately, it's stretching my multitasking ability to the limit to type thank you for that comment while I'm having the conversation with the expert. This is a good time to do it, but because there's so many good ones today, I just want to say thank you all for your questions and sharing. And if I don't get to your question today, sorry about that, and we'll try to bring you in another time. But Dawn, thanks for sharing your flight experience to Taiwan. Marissa, Huang, glad you're joining us today. Heather, Aubrey, and Robert Hedrick, thanks so much. Yes, you make a good point. Only players at stadiums, no fans. You know, that's how they started in Taiwan, but now they're bringing in small groups of fans to the stadium, and they're just seating them really, really far apart. But that's not how they started. They started with no fans. And as a baseball fan, I would be happy to see the Giants play that way to get started. And, you know, they can put out cutouts of people in the stands or just use sound effects of cheering in the stadium. I'm good with anything worth trying. All right. We are about to join Professor Lonnie Chen. Hey, how's it going, Lonnie?
Good. Good to see you.
Good to see you, too. Wow, your home is really neat.
Try to keep it clean. Try to keep a clean background.
Was there frantic cleaning going on this morning for television?
Well, it's it doubles as a student education room. So we'll be grateful when schools come back.
Okay, we're back in 10 seconds on TV, and we have about 4 minutes, Lonnie. Thank you. Welcome back. We talked about how Taiwan, a small island off the coast of China, is beating COVID-19. Now let's talk about whether the Taiwan model is exportable, as in replicable, by the U.S. and by other nations. So joining us for that part of the conversation is Stanford Hoover Institution Fellow, Professor Lonnie Chen. Good to see you again, Lonnie.
Good to be with you.
Okay, so if you look at the countries that are sort of winning the war on COVID, if you can win it at all, is, let's see, Hong Kong, Slovenia, Taiwan, New Zealand, South Korea, Vietnam. Any connections, any common threads there, and how does the U.S. fit in?
Well, I think all of them, in many cases, have tried to put together testing with contact tracing and selective isolation. So test, trace, and isolate. This strategy in general has worked. Now, what's made it most effective in places like Taiwan is that the testing and tracing and isolation has happened relatively early on in the progression of the virus. The challenge we have in the US, obviously, is with a much more widespread situation, we do need to bring that curve down, which we've done, and then start to employ these strategies going forward.
Mm-hmm. Now, Taiwan is also a democracy that prioritizes transparency, like us, right? But it has national health insurance. So how does its government and healthcare system factor in?
Well, you're absolutely right. Transparency is at the core of the Taiwan model. The reason why it is exportable to the United States in a lot of ways is because we also want to value and have a society where there's transparency around what the government's telling us about what's happening. We have a clear sense in that sense of free media. These are all elements that we have in the U.S. that are similar to what they have in Taiwan. So certainly the transparency element, it's important. Taiwan also has an effective healthcare system. Now, they have a very different kind of healthcare system because, as you alluded to, they have a single payer system and program there. But I would say that they have a very strong innovation economy in healthcare as well. So there are definitely things that are similarities between Taiwan and the U.S., ways in which we can learn from what Taiwan has done. But their example clearly is one that the rest of the world should be picking up on elements of.
Okay, but everybody there wears masks, right? And everybody self-quarantines when they're asked to. And those kind of become political battles here in the U.S. So how is it that the U.S. and Taiwan, both democracies, yet so different?
Well, some have argued that these cultural differences are pretty substantial. So in Taiwan, for example, if the government says wear a mask, by and large, most people go and they wear a mask. They don't really ask questions about it. In a lot of Western societies, that reaction response might be different. So some who study this would argue that the cultural differences make it very different. But fundamentally, I think there is a level and a measure of trust in Taiwan. And by the way, there's a lot of political polarization there too. You know, we have Democrats and Republicans screaming at each other there. They've got a nationalist party and a Democratic Progressive Party that are screaming at each other. So it's not so much that they have less political battling going on. It's just that there is a sense there that the government is trying to do its best to help keep people safe. And so you do see a lot more voluntary adherence there than you might see in some parts of America.
All right, so Taiwan has been largely sidelined on the international stage, a lot of it due to its rivalry with China, right? So wondering if this pandemic changes things for Taiwan.
Well, unfortunately, so far it hasn't. The World Health Organization has met this week for their annual meeting. Taiwan was not permitted to attend that meeting, even as an observer. And it's a real travesty, given everything that Taiwan has done, as we've talked about, to successfully fight the virus. You would think that the World Health Organization would want Taiwan's expertise, but Taiwan's been locked out of not just this meeting, but hundreds of technical meetings where the real work of public health analysis is done by the WHO. So one would hope going forward that international organizations like the WHO would embrace Taiwanese participation, but quite frankly, as long as China remains opposed to Taiwan's participation because China considers Taiwan a renegade province, it's not going to happen. So there needs to be some change. Taiwan does need to have a voice at these fora, not for political reasons, but frankly for the good of global public health.
All right, Lonnie Chen, Stanford Hoover Institution Fellow. Always great talking with you and getting your insights. Take good care.
Great to see you. You too.
We're going to take a short break on the air and keep the conversation going on our live stream platforms and be right back.
In commercial break.
All right. Lonnie, I've got time for one more question, I think. Can we chat with him?
Okay.
Okay. Yay. Okay. So we were just talking about how, you know, Taiwan still has not been able to participate with WHO in any way. But what if the Trump administration does cut off U.S. funding to the WHO? What happens then? Will that, you know, change things, and what would be the impact of cutting off that funding to the world?
Yeah, I mean, I'm of the view that the WHO is going to proceed and do what it does, whether the U.S. is contributing or not. Obviously, the U.S. is it's the biggest contributor in the world. But if you think about pandemic response, just to begin with, a lot of the pandemic funding has already gone from the U.S. to the WHO, and a lot of what we're supposed to give the WHO now has already been funded anyway. I think the question is going forward. The WHO is in need of reform. I've not talked to anybody who disagrees with that point of view. The question is what the urgency is going to look like. And I think what the U.S. is trying to do is to say, look, we want Taiwan to have a seat at the table. We think it's important, and we're willing to put our money where our mouth is on this one. So from my perspective, that approach is not entirely wrong. I'm just not all that confident it's going to alter where the WHO goes, because China is so influential in that world, in that body. So if there's going to be change, we're going to have to keep forcing the issue.
And China just made a huge donation to the WHO, too. If China is continuing to put more resources into that organization and world body, and the U.S. starts to withdraw, if you will, from it, doesn't that leave us with less influence?
Yeah, I mean, at the WHO, it does. So the question is going to be, does the U.S. want to continue participating in the WHO or look for a different place to go to address these public health issues? It's going to be a challenge to stand something up quickly. But I think a lot of people believe that new leadership at the WHO and a new organization might be needed in the future.
All right. Thank you. Bye, Lonnie.
Thanks.
Talk soon.
Great seeing you.
We're back in 10, 9, 7, 6, 5,
Thanks so much for joining us on this interactive show, Getting Answers. Hope you enjoyed today's program. See you back here tomorrow at 3 o'clock on air and on live stream. Bye-bye.
We are clear.
Thanks, Facebook friends. Great conversation today, great participation. Appreciate it. See you tomorrow.